So far, we've talked about the first bump in the spring and the echo immediately afterwards. But of course, things really started changing as we reopened our economy in Texas, and that's what we're going to talk about this time. And we're going to focus on in just this video the idea of phased reopening. So phased reopening was supposed to give us time to evaluate if things were safe, right? You had phase one, and then you were supposed to see what that did, and then later you had phase two, and then again later phase three. The idea, of course, was we're going to do it safely. But Texas moved so fast that there was no time, there was no way to evaluate what was going on, which resulted in this huge second wave, or well, it's still part of the first wave, the summer wave, okay? So, again, this is our normalized graph like we did from last time. So 0 is the lowest observation in the time period, and 1 is the highest. The darker purple color at the bottom is new cases. So these are how many cases are being announced by the county each day. The light blue is the exposure risk, okay? So as we were living through this, the information we had in real time was this dark blue, this new cases being announced. Later, we can reconstruct the exposure cloud, okay, like I explained in video 1, and we can actually see what was happening versus what we thought was happening, okay? So here, at beginning of May, we had phase 1 reopening. So retail stores, restaurants, movie theaters, and malls were permitted to open at 25% capacity. We talked about that a little bit last time. A lot of places didn't, and we actually saw in Denton County a little bit of a decrease in exposure risk after this. But you can see on this graph, compared to the graphs we were looking at in video 2, it's not a very big effect, okay? Very quickly after, less than a week after, you had hair salon, or about a week after, you had hair salons open. So obviously you didn't know what was going on with phase 1 before you started opening new things. You had hair salons, and then child care centers, youth clubs, massage parlors, gyms. Again, you're not giving more than a week or two between things. There's really not a way to understand what's going on. Now at this point, mid-May, this is where things take a turn for the very dangerous. Phase 2, this is when we opened bars at 25% and let restaurants open to 50%. Pretty much everything else that was a group activity was kind of opened at this time, indoor, okay? Bowling alleys, bingo halls, skating rinks, racing, aquariums, natural caverns, rodeos. So this May 22nd, phase 2, this really is kind of where I think that things change dramatically, and this is where the summer wave starts. But look, okay, and here's Memorial Day. By the way, if you don't remember, George Floyd was killed on Memorial Day. So Memorial Day is also a really important anchor. So what we see is that by Memorial Day, our exposure risk has already started to increase quite a bit in an exponential curve sort of shape. But new cases looks fine, right? New cases is just kind of bouncing around down there. There we go. So then not much after that, we get summer camps, youth sports, professional sports without spectators. New cases looks fine. Exposure is out of control. We are in an exponential growth period, and we don't know it at the time. And we haven't given enough time to see it, okay? By June 3rd, basically, we were going almost all the way in. Phase 3, all businesses open at 50%. And then just a couple of days later, new cases finally begin to increase in a way that makes people pay attention, okay? But if you look at our exposure curve, new cases didn't start to increase until we were close to the top of the exposure cloud. Again, my argument that what really makes exposure risk decrease is people realizing that something is wrong. So I think the big mystery here is, why didn't we see the wave coming? Why didn't we see anything that made us understand sooner or soon enough to avoid disaster that people were being exposed to this in a very dangerous level. So to do that, we're going to look at this exposure model that I've put together. So this is starting at 5/22. Remember, May 22nd, this is the day that we went into phase 2 of reopening, okay? So this is the exposure curve as it looked on that day, okay? If you went in, you pulled the symptom onset data, you built the exposure cloud, this is what it looked like. Of course, you're always going to be behind on exposure. That is the thing that I want to really get in your head, is that we are inevitably, even if we do a really great job of getting people to test as soon as they feel ill and to turn those tests around quickly, we're always going to have a week to 2 week lag, okay, in our knowledge of when people are exposed. My argument here is that the way that we did it in Denton and in Texas made it so that basically we blinded ourselves. So here's what it looked like. And what we're going to do is we're going to go forward week by week from here, okay? So these red cases that I've added to the exposure cloud, these are from the week of May 23rd to May 29th, okay? Shown there with the brackets. So the cases that you're adding, again, I cannot stress this enough. When you add cases, they are not from that week, hardly ever. They are almost always from before. So in this case, they're adding to this little, this is actually the second echo. This is the echo ripple, okay? The other thing that I'm going to put on these as we move through the weeks is this line, which is the median exposure date, okay? That means that half of the cases reported during from May 23rd to May 29th, okay, the gray bracket over here, half the cases reported during that time period started feeling ill earlier, like before the dotted line, and half started feeling ill after the dotted line, okay? So that is basically your average. And that is April 24th, almost a month before, okay? So what that's going to tell us is that if we're still adding cases, that many cases that early, we have no idea what's going on following reopening phase 1, right? We really don't know. We really don't know. And then we've made decisions about phase 2, going ahead with it, without having the data for phase 1 yet. Okay, do you see that? We don't know what's going on in phase 1 yet. That data's not in. But it doesn't matter. We forged ahead by opening salons and gyms and phase 2 already, okay? We're opening bars before we even know what phase 1 does. So the next week, we actually make up a little bit of room, okay? So we get a little bit closer. But we also are making up our mind about phase 3. So at this point, we're going straight ahead and we don't really know at all what's going on. We're still adding cases from before shutdown, okay? Oh, sorry. Now, here's the thing. At June 6th, we started to get the evidence of a new bump, okay? So this is the first time looking at your exposure model that you would be able to see an increase after phase 1. This should have been an uh-oh. Uh-oh, we've got an increase. Phase 1 didn't go without a hitch. But that was way too early for anyone to act. No one, I don't know if they were paying attention to this or if they just didn't care. So they kept opening things. So they started opening restaurants at 75%, which essentially with exponential spread means nothing, okay? When we're talking about exponents, you can't decrease things by 15% or 20% and expect to see any change, okay? But the next week, that little bump was growing rapidly, okay? And that's going to be a problem for us, okay? So we're starting to see that there is in late May, early June, a problem, a peak of some kind. But we keep opening things. Now we're opening amusement parks. A week later, this hump continues to grow. It's getting higher. Things are getting worse. People are starting to notice cases increasing across the state. Boom, bars close again, okay? But we still don't know what's going on, okay? So obviously at this point we can see, oh yeah, after phase 1 things started to increase. After phase 2 things increased even more. But closing bars didn't undo the rest of these things, okay? By the next week, we've got this too. And the thing that I want you to notice is that this median onset date pretty much just keeps hanging out wherever this peak is. So it's basically like, if you know anything about tsunamis, about half the time before they come in, they build up offshore. And so you have a bunch of water just retreating off the beach. And that's basically what we have happening here, where even as time moves on, the cases that are being announced are getting further and further in the past because we weren't able to keep up with this huge peak. So that's what keeps happening, okay? This peak keeps growing because the test results aren't in. So by July 3rd, we get the state mask mandate. A couple of days earlier, you got the city of Denton mask mandate. But how long does it take to know if those things are effective? Well, it's the same thing as reopening. Much longer than people are giving it, okay? So we keep moving forward in time, and this thing keeps growing. It keeps growing. It keeps growing. It keeps growing. And we keep making choices based on no information. We know we don't have the information, okay? So Texas announces plan for nursing home visitation. We still don't even have the surveillance done from June yet. Look, we're still adding cases from June, okay? And our median onset date, or median exposure date at this point, is way back in early July. We don't know what's going on, and we're sending kids back to school. We are blind, and we know we're blind, and we don't care, okay? And here's the problem. If half of my cases that came in this week that just ended, okay, are from before July 9th, then I know that anything after that is going to keep growing and growing and growing and growing. Look at how long. It's like 2 months. The cases that came in last week spanned 2 months. We don't know what's going on. It's a sedimentary situation, okay? So anything that would not be in the upper quartile of the observations that I got last week is going to be unstable because we know that things keep growing. Look how many weeks have been adding cases to mid to late June. It just keeps going. And this is where our resources are. We don't know what's going on right now. And so we cannot say that bars closing did or didn't do anything, that masks did or didn't do anything. We literally don't have enough data to say that yet. And people keep trying to push these narratives without the data. And I am sick of it. And there's nobody standing up for the actual how this works. And I don't, you can't act and then wait to know whether it worked or not because you'll be waiting for 2 or 3 months. You have to keep doing things, okay? So that is how we got into this situation and how, frankly, we're probably getting ourselves into another one as we speak because we are not recognizing. People keep trying to play number jockeys with the numbers that come out today, and those numbers don't mean what you think they mean. They just don't. And it doesn't help that the media and the government and the public health people keep interpreting them as though they can be used to say what things are happening now. They just can't be. And there's no way around that. Okay? I'm sorry. So, yeah, that is how reopening became such a disaster.